Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to more Celiac.com news. Understanding celiac disease autoimmunity in Nigerian children with type 1 diabetes. Celiac disease is an autoimmune disorder that affects the small intestine, making it difficult for the body to absorb essential nutrients. This condition can occur globally, especially in individuals with other autoimmune diseases like type 1 diabetes. In West Africa, however, there has been little research on celiac disease's prevalence in populations with type 1 diabetes, which prompted this study, which was published in BMC Gastroenterology, to investigate its occurrence among Nigerian children and adolescents with diabetes. Study objectives and design. The study aimed to explore how frequently celiac disease autoimmunity occurs in Nigerian children and adolescents diagnosed with type 1 diabetes. Researchers examined over 100 young patients from pediatric endocrinology clinics across Nigeria, gathering data on socio-demographic factors and clinical details like symptom history and overall health. To detect celiac disease autoimmunity, the study screened for specific antibodies in blood samples. Those with elevated antibody levels were encouraged to undergo an endoscopy and a biopsy to confirm a celiac disease diagnosis. Key findings on celiac disease autoimmunity. Among the participants with type 1 diabetes, around 6% showed signs of celiac disease autoimmunity based on elevated antibody levels. All cases occurred in females, primarily between ages 3 and 12. Most of the affected children experienced gastrointestinal symptoms, including nausea, vomiting, diarrhea, and bloating, which are typical symptoms of celiac disease. A notable finding was that children diagnosed with type 1 diabetes before age 10 were more likely to have celiac disease autoimmunity compared to those diagnosed later. Regional and gender-based patterns. This study highlighted potential regional trends, finding that most children with celiac disease autoimmunity were from northern Nigeria, which borders regions in North Africa where celiac disease is more prevalent. This geographical proximity may play a role in increased autoimmune conditions due to genetic similarities and environmental factors. Additionally, the study confirmed that celiac disease autoimmunity appears more frequently in females, consistent with broader findings in autoimmune research. Challenges and diagnostic limitations. Although antibody tests are useful in suggesting celiac disease autoimmunity, a duodenal biopsy is necessary to confirm the diagnosis. However, due to limited healthcare resources in Nigeria, most children with high antibody levels couldn't complete a biopsy. Given the expense and accessibility issues related to this procedure, the study relied on combined antibody testing to improve diagnostic accuracy. Despite these constraints, researchers could identify patterns and suggest that screening programs might help to better understand the prevalence of celiac disease among high-risk groups in Nigeria. Comparisons with other regions. The study's findings align with similar research in Europe and the Middle East, where celiac disease occurs in approximately 5% of children with type 1 diabetes. However, in certain African and Middle Eastern countries, the prevalence is often higher, likely due to genetic and dietary factors, as well as varying diagnostic practices. For example, countries like Egypt and Morocco report higher prevalence rates in children with diabetes than observed in Nigeria, which could be due to regional differences in food consumption, healthcare access, or population genetics. Implications for health practices in Nigeria. This study brings attention to the potential for undiagnosed celiac disease in the general Nigerian population, especially among children with type 1 diabetes. For individuals with both diabetes and celiac disease, untreated symptoms can lead to poor nutrient absorption, impacting their diabetes management and overall health. Diagnosing and managing celiac disease in young diabetic patients could improve their quality of life and reduce health risks related to nutrient deficiencies. Why these findings matter for children with type 1 diabetes. For healthcare providers, this research underscores the importance of routine screening for celiac disease in children and adolescents diagnosed with type 1 diabetes. Early detection can help families and medical teams address dietary adjustments, specifically a gluten-free diet, to prevent complications and manage symptoms effectively. This study encourages proactive healthcare approaches, particularly for those at higher risk, and emphasizes the need for accessible diagnostic tools. By raising awareness and improving screening practices, the healthcare community can work to address the significant but often overlooked burden of celiac disease. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.